Welcome to Make Sylacauga Healthy Again. I'm your host, Dr. Jonathon Douglas of Broadway Spinal Care. I don't know if all of you know this, but Tara and I practiced in Washington State for almost 20 years. And moving back to Alabama, there was something that was very interesting about being in practice here versus being in Washington. And there's really nothing worse than a person who comes and from somewhere else and says, oh my gosh, we did it differently where I'm from. And so we didn't say a lot of that when we first got here, but we've been here long enough now to tell you that there are some things we do better in Alabama, but there are some things we did better in Washington. And one of those things is that the integration of chiropractic, massage, naturopaths, orthopedics, neurosurgeons was so much better in Washington. I had people I would call and say, hey, I've got a knee that needs surgery. Can I get him in with the ortho? I had his cell phone. He's like, absolutely, we'll work him in. And so when we came to Alabama, we started talking to all these doctors, and it just does not work in the same way. The medical system isn't integrated in the same way. So I have a guest today who is part of the medical world as a nurse, and then she's become part of whatever the alternative world could be and doing massage therapy. And so she's going to talk a little bit about being in both worlds and how we can start to integrate this better. And even one little piece or one little person doing that, it makes a big difference because it does flow to others. So stay tuned, we're going to talk about that. So today we have a special guest. This is Michele Shurum, and she is a nurse, and she's also a new massage therapist and new business owner. And so tell us a little bit about your nursing background.
So I have been a nurse for 16 years now. My background is critical care, mainly ER and CCU. I have been a hospice nurse for 10 years now. I've always done that on the side. That has been my passion, love helping others, fixing others, just being there for others.
And then how did that flow into massage therapy?
Just, like I said, just knowing that you're helping someone, it just goes hand in hand together. Just knowing that you are being able to help them, heal them. Being there for their needs.
What do you see in the medical world that could work better with massage? So when you're in a hospice situation, do you see times that maybe they could be helped more than they are in that situation? Or what do you see?
Yes, because pain. Even with hospice patients, they have pain. They have emotional needs, mental, physical, and emotional that medicine's not always going to touch. Mm-hmm. It requires contact, it requires being in tune with that patient, and that helps more than anything.
We learned in chiropractic college, I'm sure you learned in massage therapy, that even if you touch someone, most people aren't touched in life. In regular mm-hmm. life, if you never think about this, most people are never touched. Because at work, you can't touch a coworker, right? So it's mm-hmm. become unusual to hug someone.
Right.
So when a person comes in to see a practitioner that touches them, it's unusual, number one. Mm-hmm. And then it really doesn't even matter what you do to someone. If you touch them in a way that's caring and you're trying to help, they always do better.
Right.
And from what I've seen of hospice over the years is that those people sometimes are kind of thought of as on the way out, mm-hmm. and that they become less of a need for being touched, and it's maybe scary to touch someone who's sick, and
yes.
So couldn't be any more important time to be touched than when you're on the way out, in my opinion. So I can see how that transition works. What kind of conditions do we treat with massage?
Oncology patients, sports, prenatal, just therapeutic or Swedish, and we do a lot of that, mm-hmm. relaxation. Mm-hmm. Sciatic issues, just pain relief, hip, back, shoulder, just anything in general.
Some people think of massage as a luxury, like a spa kind of experience. And some people do come for that. I'm sure they want just a relaxation massage, but we had a massage therapy clinic for 20 years, and so I've been around massage quite a lot. And I can tell you that what I think is the best utilization is preventative, that if people move better, feel better, then they don't have the problems that fall apart, basically. Is that what you see too?
Yes, a lot of people have that misconception that massage is for the wealthy, that it is just a luxury, but it's not. It is a health benefit. Massage has so many benefits. It helps reduce anxiety, stress, depression. It lowers your blood pressure. It increases circulation. It improves flexibility and reduces pain. So there's a lot more to it than just it being a luxury.
Absolutely, and I haven't talked to Michele about this, but we went to a continuing ed seminar over the weekend, and there was a doctor who has musculoskeletal ultrasound in his office, which I had never really seen used in the same way. But what he did is he's done all these studies where he puts people on a flexion distraction table, which is a table that opens up, and he did it mainly on low back pain patients. And so he puts ultrasound on there, and he's looking at how the skin glides over the muscles. And so when we're babies, our connective tissue glides like this, and when you look at kids, it just is so smooth. We have all of these juices that are allowing it to flow, right? And we've never had a fall off a swing set yet, or whatever we've done to ourselves, or we haven't sat at a desk for 20 years and not moved. And so all of our connective tissues flow. And we've always thought that the muscle creates adhesions within itself. And that's always been the theory of why people lose flexibility. But what he's showing is that when you have someone who has chronic low back pain, when you bring them into flexion extension, you should see that glide. You literally see no glide. He showed it, that their skin is attached to the muscle and it all goes together. There's no movement. I'm not saying there's a little bit of movement, there's no movement at all. And then when you have someone who doesn't have chronic pain, then their tissues glide like a baby. And so what he was doing is he's doing cupping and he's doing like gua sha kind of scraping. He's got a massage therapist. But what we're really doing, and in chiropractic the same kind of thing, we're breaking up those adhesions between the skin and the muscle. And if you break up the adhesions between skin and muscle, then you move better.
Right.
Right. And so every day we should move in every range of motion. We should. And nobody does. You think about people go from bed, and then where do they go? They sit for breakfast, and then they get in their car, and then they do it. Sit at a desk, and then they come home, and what do? Sit and watch TV, and then they go to bed, right? So there's no range of motion there. And so what you're essentially doing, and what we do, is we break up those adhesions. How has it been being in business? Is it an experience to have your own massage clinic?
It's an experience for sure. There is a lot of red tape. And there is a lot of learning, and it is a learning process the entire way. You learn so much in school, but all the learning is really once you finish school and get out on your own. So I'm still learning as I go, but it is an adventure, and it is worth it.
Oh, sure it is. And one of the things we've talked about when she's come in the office and we've talked is that people who are experienced in business, we feel like we should really help mentor people who aren't, because we've made every mistake you could possibly make in business, and it's really hard when you get started in any kind of business. But I think especially in Alabama as an alternative medicine person, because it's just not accepted in the same way that we saw on the West Coast. Are you seeing that doctors are sending you people? Do you have MDs? Is it because of your nursing connection too, or is it because of what you're doing with massage, or maybe both?
Probably a combination, but I have a lot of chiropractors that refer to massage. They go hand in hand together. But yes, I would say more chiropractor than MD that refer to me, because it's the pain relief and the flexibility, and that works together well instead of the medicinal route.
Correct.
So it's more holistic approach.
One of the things I think is hardest about referrals is that a lot of doctors think of patients as being their employee. And we always talk to our young doctors about that, is that actually as a doctor, they're the employer. So the patient's coming in and you have to listen and try to help, because they literally are employing you.
Right.
And so if somebody comes in to see you and they're not doing great, or it's not something you can help, and you make a referral, like if I make a referral to you and then they do great, that actually makes me look good. They're happy with me, they're happy with you. That's the way the system should work.
Right.
But right now, the way it works, from what I've seen, and this isn't just here, this is in Washington in some areas too, is that people come in and then you can't help them, and they're like, oh, you can't be helped. And then they're just done,
It's not true.
which isn't fair, and that's not really a service
Right.
to the patient. And so I hope that seeing you in nursing plus massage helps maybe a couple of the MDs in town too say, oh my gosh, this is a person that is kind of in our world and kind of in this other world, and maybe I can learn more about massage, because it
Right.
really would help a lot of patients that are just not being helped
Right.
in the same way.
And nursing, I mean, as being a nurse too, I feel like it benefits because back in the wartime, nurses were trained as massage therapists, and they would massage the soldiers to improve their flexibility and decrease pain and all for them during that time. And also, like, you have the increased knowledge of A&P, anatomy and physiology, and you just have more compassion and care that you can provide.
Yeah, absolutely.
So,
Appreciate you coming on today.
thank you.
Yeah. And Make Sylacauga Healthy Again, we're going to have all kinds of different practitioners, and we're going to have all kinds of different ideas coming on, but I'd say the main focus is read labels, like we talk about all the time. Eating is so important, but prevention is so important. And so if we can utilize chiropractic, massage for prevention,
Right.
then we're so much better off. Yeah. So you can't start a fire without a spark. And so it takes a couple of people trying to integrate themselves in, and then educating some people in the old kind of a system, and then things start to change. So appreciate you having here.
Thank you.
Relax and Renew is the name of her place in Alex City. I forgot to say that. We'll see you next time on Make Sylacauga Healthy Again.